7 high-paying healthcare jobs you can get without an MD or PhD. You don't have to go to med school, earn a doctorate, complete a residency halfway across the country, and rack up thousands of student debt to land a top-paying job within the healthcare field. While physicians and surgeons continue to earn some of the highest salaries in the nation and top the payroll for medical institutions, plenty of other positions require less education while paying salaries as high as $167,000 a year. Here are 7 high-paying jobs you should consider if you're interested in helping people but aren't keen on the idea of becoming a doctor. Number 7. Radiation therapists. Part of the healthcare team called in to treat cancer, these therapists operate the machines that deliver concentrated radiation therapy to a patient's tumor. They are also responsible for explaining treatment plans to patients, determining the region of the body receiving treatment, and checking for unusual reactions. Employers usually prefer to hire applicants with at least an associate's degree in radiation therapy, though some companies accept those who've completed a certificate program. Annual salary, $82,330. Number 6. Genetic counselors. Genetic counselors assess individual or family risk for a variety of inherited conditions, such as genetic disorders and birth defects, by studying patients' genes through DNA testing. They provide information to other healthcare providers as well as to patients concerned with developing or passing down inheritable medical conditions. Genetic counselors typically need a master's degree in genetic counseling or genetics, as well as certification through the American Board of Genetic Counseling. Annual salary, $80,370. Number 5. Speech-language pathologists. Sometimes called speech therapists, these workers diagnose and treat communication and swallowing disorders in children and adults. Most speech-language pathologists working today hold a master's degree from an accredited program. All states regulate this role, and most require a license. In states that do mandate licensure, pathologists need at least a master's degree from an accredited program, supervised clinical experience, and to pass an exam. Annual salary, $77,510. Number 4. Nuclear medicine technologist. These healthcare workers prepare radioactive drugs for patients to assist with imaging or therapeutic purposes. They operate the imaging equipment used to diagnose and treat patients. They may also help physicians in researching the uses of radioactive drugs. Nuclear medicine technologists typically need an associate's degree from an accredited nuclear medicine technology program. Annual salary, $76,820. Number 3. Nurse practitioners. These nurses serve as primary and specialty care providers. They often work independently or in collaboration with physicians. They assess patients to determine the best way to treat or manage a person's health issue. Many nurse practitioners specialize in caring for certain needs, such as geriatric health, pediatric health, or psychiatric and mental health. To become one of these advanced practice registered nurses, workers must earn at least a master's degree from an accredited medical program. They must also have a registered nursing license before pursuing education in one of these advanced practice roles, such as nurse practitioner. Annual salary, $107,030. Number 2. Physician assistants. Commonly called PAs, these workers assist physicians and surgeons and examine, diagnose, and treat patients. They may be called upon to review a patient's medical history, examine a patient, order and interpret diagnostic tests, diagnose a patient's injury or illness, provide treatment, prescribe medication, and counsel patients about their health. To become a PA, you'll need a master's degree from an accredited program. It typically takes 2 years of full-time study to complete. All states require physician assistants to be licensed, meaning they must pass the Physician Assistant National Certifying Examination. Annual salary, $108,610. Number 1. Nurse anesthetists. These nurses provide anesthesia and related care during surgical, therapeutic, diagnostic, and obstetrical procedures. Before a procedure begins, they are responsible for reviewing a patient's current medication as well as any allergies or illnesses they might have to ensure anesthesia can be safely administered. To become one of these advanced practice registered nurses, workers must earn at least a master's degree from an accredited medical program. To qualify, they'll need to have a registered nursing license before pursuing such education. Annual salary, $167,950.